House Bill 4346, sponsored by Representative Cambensy. Rep. Cambensy is here with us today. Glad you're here in person, and we look forward to hearing your testimony on the bill.
Thank you, Madam Chair and committee members. I'm here to present a bill that I introduced last year, shortly after Colorado became the first state to introduce a cap on insulin monthly purchases. Why is this bill important? I could tell you as a diabetic myself for 34 years, a type 1. I've watched a vial of insulin that I used to pay $20 for go up considerably in price. $20 was the actual cost of the insulin. My copay was $0 at the time. A little bottle like this takes me a month to go through. I'm on a relatively low dose. Some people, it would take them 3 vials of this a month to use. But the cost now for any given insulin, there's 3 different companies that offer it, is up to almost $580 a month for 1 vial. So if you need 3 vials a month and you don't have insurance, how do you pay for it? You received a handout from LSB that we did last year, getting some research on this item, and I just want to go through some points on that handout. We specifically asked LSB to help us determine if this bill was right for Michigan. We asked how the price of insulin has changed over the last 2 decades, how many people ration their insulin in the state because they can't afford it, or if they didn't have that information, how many nationwide, and what are the known or given reasons for the rise in the cost of insulin. According to the Centers for Disease Control and Prevention, approximately 864,882 Michiganders have diabetes. That's a little over 11% of our population. It's about 1 in 10 people in each of our districts. When you look at the rates of deaths that we've had in diabetes over the last 20 years, we're not doing a great job of bringing that number down, even with new medications and the access to health care. But how has the price of insulin changed? In a 2016 study from the Journal of American Medical Association, they found that the average price of insulin nearly tripled from 2002 to 2013. That increased from $4.34 per milliliter, and this is 100 milliliters, to $12.92. A 2019 brief from the Healthcare Cost Institute estimated that the median price of insulin products nearly doubled to a 92% increase from 2012 to 2016. More recently, the U.S. Senate Finance Committee requested information about drug price increases from 3 insulin companies, and there are only 3 companies worldwide, about how they price their insulin. Eli Lilly's prices have went from $35 in 2001 for 1 vial to $234 in 2015. It's a 585% increase. Novo Nordisk's Novolog went from $289 in 2013 to $540 in 2019. It's an 87% increase. And what we're finding is that these insulin companies will use each other. So when one raises their price, the other company raises theirs. And there's basically no transparency behind how that's being done. If you look at page 4 of 6 in the LSB handout, when we look at what are the known or given reasons for the rise in the cost of insulin, the first one that you'll hear quite a bit from my colleagues that are also co-sponsors on this bill, but also have bills in this package, is a complex supply chain. And in there you have pharmacy benefit managers, kind of a middleman who is negotiating and making different agreements between the companies and the providers. We know that list price of insulin set by the drug manufacturers are often cited as contributing to the rising costs. And the report does suggest that the prices of one manufacturer, again, bump up those of the other. We also noted a shift towards more expensive insulins. I've been on this same insulin since the early 90s, again, going from $20 to, almost $600. There has been no change to this drug. And what some people think is going on is that because there are so many diabetics and because so many people need insulin, that the revenue made from this drug, and certainly the increases, is going in to fund research into other drugs and other diseases and cancer. Is it fair? I don't know. But for the person that needs insulin, that within a matter of hours, days, or a week will die without it, it's become a serious problem. And just to shift a little to talk about if some bill like this is even possible. Last year, Colorado was the first state to enact this same bill. As we sit here today, Kentucky just passed a similar bill yesterday. But before that, there are 15 other states that have passed this bill in the last year. Minnesota, Washington, D.C., Colorado, Illinois, New Mexico, Maine, West Virginia, Utah, Washington, New York, Virginia, Delaware, Connecticut, and Vermont. So as you can see, it's not something that is just unique to Michigan. It's a problem that I think we have nationwide. And as we look at this healthcare package and as the first bill to really get a hearing and why that's important, I'm hoping you'll consider it and consider that it is only for state-sponsored healthcare plans. It does not cover the uninsured, and it does not cover programs even like Medicaid, where we do get federal dollars from. Because we can't regulate that as state legislators, it does leave a narrow group of people that this can help. But what each state wants to do by passing that is really urge Congress to take that next step and make sure that we are holding the pharmaceutical companies accountable and put in some regulations for pricing. And with that, I just want to follow up on one question that I might get, and that is, if we implement a bill like this, will we see the cost of insurance go up? I think that's something that a lot of people have said, well, Sarah, we can do this, but they're just going to pass the costs on to others that don't have diabetes or have different insurance companies. But so far, every state that has passed this, all of their regulating actuarial services that they contract, they have found that the increase has gone up either 0 to 80 cents a person per year. Most of them have claimed that it is less than $1 per year. But the words that they use are non-negligible amount, and there's non-negligible and de minimis, meaning basically nothing. So the question is, can we start here in Michigan? Can we see a bill like this also pass and be part of this bill package that I think is going to offer all of our constituents their number one priority when we talk to them or we get on the phone with them or run into them in the grocery store, and that is the cost of prescription drugs are forcing them to make decisions to either go without, ration their medications, take less so that they can afford their rent, afford their mortgage, or put food on the table. So thank you for your consideration, and